DOLA patient-ready orthotics. The orthotics podiatrists use. A collection of our 9 most popular and proven prescriptions developed from over 50 years of clinical and orthotic experience. Patient-specific styles, ready to fit in clinic, orthotics for health professionals only. The Rearfoot patient-ready orthotic is designed for patients showing signs and symptoms of pathomechanics of the posterior foot and leg and impaired sagittal plane function of the ankle. This video will help you identify which of your patients will benefit from adding the Rearfoot orthotic to their treatment plan. What type of foot will it help? What does it look like and how does it function? What conditions will it help? And why will this patient-ready orthotic help your patients? Your patient may present with pathologies of the rear foot or posterior leg from an injury, overuse, or related to a disease process. These include common rear foot pathologies: Severs or Calcaneal Apophysitis, otherwise known as kids' heel pain; Retrocalcaneal Bursitis or Haglund's deformities; and lower limb and ankle pathologies, including Achilles tendinopathies, Gastroc and Soleus pathologies, anterior ankle impingement, or extensor tendinopathy. Rear foot pathologies can be linked to different foot types, gait patterns, and pathomechanical function, including the supinated or pes cavus foot, the pronated or flat foot, and even the relatively normal or neutral foot. It is most commonly seen in patients with ankle equinus or a sagittal plane block of the ankle. The foot may present with a primary ankle equinus, with proximal and distal compensations at the knee, hip, subtalar joint, and midtarsal joint. On assessment, there is a reduced non-weight-bearing ankle range of motion and reduced weight-bearing ankle function. A sagittal plane block of the ankle, or an ankle equinus, is a decreased ankle range of motion due to tightening of the posterior structures, including the Gastroc or Soleus. Distal compensations for ankle equinus occur at the subtalar joint and mid-tarsal joint and will impact on the first ray, first MPJ, and forefoot function. Pathomechanics may include avoidance of first MPJ or high gear toe-off. This is often related to functional hallux limitus or impaired propulsion and windlass function. On functional examination of the windlass mechanism with Jack's test, results may include a reduced range of motion compared to non-weight bearing, high force needed for activation, or a delay in initiation. Poor shock absorption, impaired sagittal plane function, or proximal compensations may increase the tissue stress on the posterior foot structures beyond their capacity. Mistimed gait events may also contribute to pathomechanics, including heel strike, prolonged mid-stance pronation, lack of resupination, early heel lift, midfoot brake, low gear toe-off, and impaired propulsion and windlass mechanism. The signs may already be there in your current treatments, giving you confidence that the Rearfoot orthotic will help your patients. Have you had success with Achilles taping, a footwear change to a style with a larger drop, stretching or strengthening program, improved capacity of the pathological tissue, or treatment-directed testing of a heel raise, or has your patient had previous insoles? All of these may indicate that the patient-ready Rearfoot orthotic will be a successful option. So how does the patient-ready Rearfoot orthotic help my patient? This orthotic is specifically designed for patients with rearfoot or posterior leg pathologies to address the most common pathomechanical causes. Stable rearfoot control. The rearfoot platform provides stability for the transition from heel strike to mid-stance. The medial arch support provides support for the medial arch for transition from mid-stance into propulsion. It improves the windlass activation, forefoot stability, and promotes a high gear toe-off. The lateral arch support stabilizes the foot and aids in the transition from heel strike to toe-off. A moderate heel raise reduces tissue stress on posterior structures and improves sagittal plane transition from mid-stance to propulsion and addresses any ankle equinus. The full-length performance EVA shell provides the combination of cushioning and control needed by this foot, and the luxury DuraFit top cover is designed for both daily and sporting activities. For more options to fix the feet that walk into your clinic every day, see the full patient-ready range and be sure to check out the rest of the training modules. Need help finding the right orthotic for your patient? Use our online orthotic selector tool. Tell us about your patient, their activity level, pathology or lifestyle and performance goals, their foot type, clinical test results, and we will recommend the best patient-ready orthotic from our range. For daily education and training, follow us on social media, including Facebook and Instagram. Subscribe to our YouTube channel, follow us on LinkedIn, or visit dollarorthotics.com.